Meet Bob. He has the dreaded dowager's hump. Meet Veronica. She has the dreaded dowager's hump. The dowager's hump is not uncommon. You see it at work. Your neighbor has it. Then there is that woman at the grocery store, and the list goes on. Fortunately, your grandmother's doing just fine. The dowager's hump, called hyperkyphosis in medical terms, is an increase in the forward curvature of the spine. This bent-over posture is often mistakenly associated with older women. And since the word dowager means dignified older woman, people started calling it the dowager's hump, even though many people who have this slouch are not elderly. In fact, Egyptian mummies from 4,000 years ago have been found with this hump. And it's not clear what's causing it, but some have theories that it has to do with a lack of variety of movement patterns. And it can also run in families with genetic influence. And a lot of folks who have this don't even see it developing because they're looking forward at themselves in a mirror and not viewing their own profile. Your head, when accented forward, causes a lot of strain on the body and increases your risk for further injury. As we age, we repeat our patterns. We have more injuries and pain. Our posture gets worse, and with our joints getting stiffer, we get lazy with our movements. Fortunately, there is preventive care and treatment. One of the best ways to prevent the dowager's hump